Good morning, media. Thank you for coming out this morning to the Hamilton Health Center. The City of Harrisburg is incredibly pleased to announce this morning a path-breaking, precedent-setting partnership between our city and the Hamilton Health Center to help test children in our community for lead. This is part of a $3.7 million HUD grant that was given to the City of Harrisburg. And what's new and exciting about it is the partnership that we have here today with the Hamilton Health Center. Let me see if I can make the volume any better. As a part of this grant, we will be purchasing state-of-the-art equipment, which will allow the testing of lead to be quick and efficient and to be able to get immediate results. And it means that everyone who comes into the health center will have the opportunity to be tested, and then they can be referred into the city's lead remediation program. And there's a simple form that is filled out, and if you qualify, which means you are within 80% of the median household income, you will then be eligible to having your home remediated. The city will send a risk assessor out to the property. It will determine the level of remediation that is necessary. And then we hope, over the span of the next bit of time, by November 2018, to have fully remediated our goal over 200 houses right here in Harrisburg. Now, if you're under the age of 6, lead poisoning can be a very dangerous thing. It can retard your development and your growth, and it's something that we have to take very seriously. And part of the communication that we want to get out here this morning is that we want to encourage parents and relatives to have their children tested. As you probably know, most of the housing stock, the overwhelming majority, 90% of the housing stock in Harrisburg was built pre-1978 and contains lead paint. And when that paint begins to fail and chip and build up on windows and doors and other surfaces, it can pose a great health risk. A neat feature of this program is that you don't just have to be a parent with children to qualify for the program. You could be a grandparent or an aunt or an uncle or another relation, as long as the children come to visit you in your home for only about 60 hours annually. So imagine coming once a month for an overnight visit or an extended period over the summer or the holidays. If you qualify financially at that point, your house could also be remediated for lead. So grandparents, aunts, uncles, anyone who's dealing with children under the age of 6, this is a great opportunity to take advantage of the program. Once we send the risk assessor out to determine the level of remediation that's done, we've partnered with a variety of local contractors who will then come out and do the work. Some of them are in the audience here today. I see Tariq with TLC Construction, Mr. Navarro, Pascual Navarro, and there are others, and what they are going to be doing is doing things such as replacing windows and doors and other forms of remediation to make the house safe to live in. We have an MOU here, which we're going to sign in a moment with Hamilton Health, which is precedent-setting as well in that the city will be purchasing the state-of-the-art equipment, which will then be being used for the testing. And we really want to emphasize that we are fortunate in Harrisburg to have a center like the Hamilton Health Center, deeply connected and rooted in the community in meaningful ways, because that's going to mean that we're going to be able to deploy the dollars of this grant in a way that's going to be most effective. We're very excited about that, and I want to turn things over for a moment to Janine Peterson, who is the CEO here of the center, and she can talk a little bit more about what this MOU means for the residents of our city. Janine.
Good morning, everyone, and welcome to Hamilton Health Center. We are really pleased and honored to be partnering with the City of Harrisburg. Mayor Pappenfuss, this is precedent setting. This is the first time that the City of Harrisburg and Hamilton Health Center will be partnering on this initiative. Hamilton does serve over 8,000 children annually, just in our medical departments. So as you may know, we are a federally qualified health center. We provide services for adults as well as children, but we're also the WIC provider for the County of Dauphin, and our largest site of WIC services is right here in this building. So we will be doing testing in the WIC program as well as in pediatrics. We will also be hosting events here in this community room in conjunction with the city, where education will be available as well as screening. So we certainly have qualified clinical staff that will be conducting that testing, and then results would be provided and immediately, because this state-of-the-art equipment that will be purchased will allow us to actually give that result today on that day of the test. We do testing now, but we have to send our families out in WIC. They are told, go to your family doctor and get that test. We do testing in peds, but we have to send those tests out and then have to wait for the results. So as you can imagine, if we have that family here right on the spot, and then we give them the results, we can then start the process of getting that form filled out, getting the assessment done so that those houses can be remediated. And we can provide whatever clinical information and support is needed if that child certainly is tested with high levels of lead. So again, we are really proud and happy to be initiating this. We think this will be a great opportunity for the families of the city of Harrisburg to have this kind of service available.
Thank you, Janine. Thank you, Janine. Before I hand things over to Damian Slaughter, who is our lead program manager, I want to mention that Andrew Bliss is here from Capital Region Water. That's important because a lot of times, at least today in the news, when you think about lead, you might think about Flint, you think about the water. Harrisburg does not have a lead problem with its water. Let me repeat that. Harrisburg's water is phenomenal. It's some of the best anywhere in the country, and it's tested regularly, and it is safe and clean. At times, however, people's pipes inside their homes, however, may contain lead. And one of the things that Capital Region Water can do is it can help work with homeowners to identify whether piping needs to be upgraded. They can also test the water at the tap to make sure that those interior household pipes haven't contaminated the water. And we're working closely with Capital Region Water throughout this process, and they are a true partner. So I wanted to acknowledge that they are here standing with us today. And I wanted to turn things over to Damian. And Damian, again, if you could emphasize why this cooperation is precedent setting and why it's so, I think, important for our residents.
Thank you, Mayor. Absolutely. First of all, thank you and good morning to everyone for showing up today. One thing about this initiative that we've started here in Harrisburg is definitely precedent. I had the opportunity to attend a lead conference in Albuquerque, New Mexico last week. And the consensus over the conference was trying to get the local participation, the administration on the local level to participate with this issue that we have in this country. And the overwhelming comments were we just can't get the administrations to help, the city legislators to help with boots on the ground to get this initiative done. I felt very confident during that meeting that I had a leader that will listen. I had champions in the community from Hamilton Health that will listen and was eager to help our citizens here in the city of Harrisburg, mainly our children. So with that said, I want to thank you, Mayor, for really championing this effort. I want to thank Ms. Peterson, Ms. Regina King that helped us through this process to get this underway, our legal department that did what they had to do to make sure that we had all the legal avenues covered to see this initiative head forward. I want to thank our contractors. We have lead certified contractors in our community that will be helping us with this initiative as well. Again, reaching into our community for the skills and talents that we need, and they're certified and qualified to be able to do this job. The staff from back in DBHD, Judy Ramon, Mark Stone, all of us that's been there working so hard. We have intake specialists that have been doing the work along this time, but Hamilton Health will really give us a shot in the arm to be able to do what we need to do. Our goal is to, like as the mayor said, to assess 200 units throughout this community and make it lead safe for our children. The bottom line is make sure that our kids are safe, have a safe home to thrive and be prosperous in their life. And we don't want to do anything intentionally to affect our children, as has been done in cities across this country. So we're not shying away from the challenge. We're going to take it head on and do the very best job that we can do. Thank you.
Thank you, sir. So we're going to sign this MOU here in a moment, but I want to just reiterate in sum. If you're hearing this message and you have young children and you live in the city of Harrisburg, or even outside the city of Harrisburg, come to the Hamilton Health Center and get your children tested for lead. It's free, it's instantaneous once we have this new equipment that we're going to be purchasing with this MOU today, and it will give you access potentially to the city's resources here funded through the federal government to help have your home assessed and then remediated for lead. So that's the message. And the other takeaway, I think, from this press conference is that we are fortunate to have a partnership here with the Hamilton Health Center and the city so that we can reach those communities that are truly in need here in Harrisburg. Okay, fantastic. I'm going to clap for us. All right, there are a lot of other people in the audience here. We have nurses, professionals. If anybody would like to ask technical questions, I won't be able to answer those, but we can if you have questions about the equipment that's being purchased, the process, all those things. Technically, I think Portia had her hand up first, but okay.
Has there been an increase in children who have had elevated lead levels over the years here in Harrisburg?
The historic data on lead in Harrisburg, could either of you address that? And I know, Damien, you've been part of this group.
Actually, yes, the numbers has increased, but keep in mind, EPA, CDC, they have increased the trigger level to now is 5 deciliters of blood, where previously it was 10. So now we're getting that. We're also getting those numbers from those children that were tested previously. So yes, the numbers has increased.
And do you have a goal? You said you have a goal to assess 200 units, your goal number of children that you want to test? Because the way you're saying it is you can have your children tested and then if it comes back, they're not exposed and
No,
Every child. I would say every child under 6 we want to test, and it would be free. We have the capacity and the funds to be able to do that.
Have you had an increase in the number of people who are requesting tests from just, I mean, anecdotally, are you hearing that from doctors in your network that you interface with?
No, the real need has been to get the children tested, and I think what's going to be positive from our initiative is we can give immediate results. So that's going to be the key. So we're not having that disconnect where we test, send it off to a lab to be analyzed, then get the results, and then move on through the process. We're able to do everything pretty much immediately.
Sure, because I was just kind of wondering, parents seem to be a little more concerned because of all of the press about the situation and other places.
Absolutely. And that's why we wanted to bring this initiative to Harrisburg, to say that we're trying to be ahead of it, and don't want to be proactive, but, be reactive. We want to be proactive and head this thing off.
Hamilton, do you all have the numbers? Can you quantify this for the media in terms of the percentage of children that we're able to test now, and hopefully how we'll see that percentage grow with the new equipment and the new partnership? Sorry to put you on the spot, but you're doing it every day, so.
Yes, currently we're testing about 20 kids under the age of 6, but once again we have to send those tests out to labs. So with the new equipment that we have in-house, that we're going to have in-house, we're actually we're predicting that we should be able to double the amount of tests that we're doing. And then keep in mind that we've only been doing this so far in our pediatric department, and we are moving this to our WIC department, and we're also looking into being involved in some of the community events as well. So we'll be screening at some of the community events out of the community. So that's going to actually increase our numbers as well.
And is that 20 kids
is that 20
per month? Or?
No, that's 20 per day. So.
Oh, 20 per day.
So 20 per day, potentially to 40 per day. The idea is to have it be just a regular part of one's healthy screening,
exactly,
as opposed to a special test that you have to order and then, find out results sometime later. And that'll make a big difference. And not only can you get the results right away, but then you can fill out the form right away. The city can get that information right away and can move quickly, as opposed to not only having to track down somebody to tell them their results, but then to have to encourage them to apply. I mean, that's just not the way to do it. This is the way to do it. Get it all done at once, and get the assessor out of the home quickly. So, very good. Yes?
Without this program, how much would it normally cost for a parent to have their children's blood?
It's currently free to do that test as well. It will remain free. The benefit is that the new equipment which we are purchasing with the MOU allows for the faster results, and will hopefully see broader participation. And we now have buy-in from the whole center, the entire community, to really sort of suggest this to parents as they're here, and to make it a regular part of the checkup. I think that would be correct, but please, yeah.
And I think the other important piece of this is, up until this time, any testing that Hamilton Health Center has done is for our own patients. So you'd be in pediatrics as a patient to get the test. This testing is free to anyone that would come and need a test. So you don't have to have us as your primary care provider to actually access the testing. And as Regina said, we will be in the community, so anyone that comes up and sees us there, they can get tested at that location. So you don't necessarily have to come here, but if you do, it doesn't matter whether you receive other services here. I think that's extremely important.
And there will be more about the community integration of this. The MOU provides for not only equipment for the Hamilton Health Center, but also for mobile equipment that we can take on the road, so to speak. And we're hoping to have robust partnerships with the school district and other entities to expand testing so that we can get to 100% of children under 6 in the city. Yes?
How soon will you have the new equipment, and can you kind of describe what exactly the equipment is?
I was hoping that we could actually do a lead test for you this morning. That would have been fun. Could you describe the new equipment? Who can speak to the new equipment? Because I haven't seen the new equipment. Okay. How does it work? How quickly does it hurt? How quickly are the test results done?
So we will be purchasing a clear wave lead analyzer, and we will be able to receive the results back within 3 to 5 minutes. It is only a finger prick for the youth. So I can't say it's not going to be painful, because everybody has their individual pain levels. However, it's not a venous blood draw. It is just a simple finger prick.
Like somebody would have for diabetes? Or...
Exactly. So if you're diabetic, you would have to prick your finger. It would be that same thing. For youth, we do use smaller needles. So as far as I've learned in my years of nursing that if you're talking to them and you have somebody else prick their finger, they don't even know that you've done it.
So this analyzer, is it like a machine kind of thing?
Yes, it is. So what you do is you prick your finger, you put the blood on the card goes inside of the analyzer, it runs the test while it's in the analyzer, and then you receive the results back.
And I'm sorry if you already mentioned this, but so then on would the nurse or whoever this is administering the test provide, or out in the community or in the clinic, provide information to parents about lead-based paint remediation? And the $3.7 million from HUD is for that amount for this, or for both?
Oh, it's for everything, including the actual remediation of the homes. Now that can be expensive. We're talking about could be $13,000 a home for 200 homes. You can see how that can add up. Talking about imagine replacing all the windows in a home and the doors. So, do we know when the equipment's going to be available?
It's
About 2 weeks. You can still come in tomorrow and get tested, but you won't have the instantaneous results for about 2 weeks. And then the other part of this partnership is a commitment on the part of Hamilton Health to connect them to the city's program. So, and frankly, you don't have to test positive for lead to be eligible for the program either. You could still, that would be an ideal situation where somebody has not yet been contaminated, but they're living in a house that does have severe problems and needs to be remediated. So you'll be able to be tested at the moment, and then you can apply for the program. And if you qualify for the program, you could have your house remediated, whether or not you've already have lead in your blood.
Did you have to own the property to request the information?
And no, you don't. So that is another important thing. So not only do you not have to be, a mother or father or a primary home, you could be a relative that has children visiting. I think it was 60 hours annual. If you have children under the age of 6 visiting your home or your apartment for 60 hours annually, you could be eligible. And again, this applies to apartments as well. And there's an agreement that has to be signed between the owner of the apartment, which, among other things, says that you can't raise the rent. You have to continue to rent for, a period of 2 years, 3 years to the person. So you can't qualify for the program, have all this work done, and then, I'm going to raise the rent and kick the person out. So rental owners are eligible for the program. Yes.
So the new machine, you'll just prick a child's finger and then the results will come like in 3 to 5 minutes.
Yeah.
Right now, do you guys draw blood and then you have to take it to a lab and it takes several days? Is that the method?
That is correct.
Okay, I just wanted to confirm that.
Which is cumbersome, and you can see how that's not immediate, and it's also not a part of it's an opt-on addition, which is not necessarily integrated into the whole care, which this can now be.
And just to reiterate, I think someone mentioned about the problems in Flint. Did that at all prompt this partnership with Hamilton Health?
No, I think we've been interested in partnering with Hamilton Health since before Flint made it into the news.
Okay.
I think it has raised public awareness of the seriousness of this issue, and if there is something positive that we can take from that, it will hopefully be the fact that more people will want to be tested and will recognize the dangers of lead. So we hope to capitalize on that and to get all children in Harrisburg tested. We should note that when we announced this grant, and I think this is very important, Harrisburg received as much money as the city of New York. I mean, as other major metropolitan areas, we were one of just a handful of cities in the country to receive $3.7 million from the federal government to do this. And that's because the federal government felt that we had a good model proposed, but also because the need is very great in Harrisburg. So we are very appreciative of having received that, but we're going to do everything that we can to make sure that that money is spent wisely so that we don't have a future crisis and that we're able to address it now.
And if someone could talk about just why children under the age of 6, maybe just how vulnerable they are, if they do have elevated levels of lead.
Thanks. Yes, so I'm assuming it has to do with developmental issues in children, but I'm not a medical professional. Could one of you speak to that? Otherwise, I'm going to sound very, okay.
The thought from HUD is that's the age in which the kid is beginning to develop. So now if they're exposed to the lead and just the lead, now it's going to develop along with them, stunting their growth, affecting their nervous system, affecting their IQ level and their ability to learn. It's just that critical period where the human body is beginning to develop. So that's why HUD has honed in on kids under the age of 6 to try to prevent it from happening.
And to go back to the lead-based pain remediation program, you said the goal is to do 200 units by the end of the year or within 1 year from now.
The period of performance is 36 months. It began December 1st of 2015, and we run through November 2018.
And how many have you done so far this year?
So far, we have roughly 10 units in our pipeline, and we've actually done or completed about 2 of them so far.
And is that the normal rate? Like, how many do you usually do in a year or 36-month period historically?
Within a year, we're going to try to do about 60 of them, and it's going to ramp up now. We just completed our information for bid process to get our risk assessor on board. We've already had our lead certified contractors on board. They've been ready from the onset, but now we have a complete team, so that unit production should increase.
And normally, how many this year have been remediated in Harrisburg, like prior to now? has been pretty consistent with 60 a year or fewer than that?
In the previous grant years, we've done probably 50 units per year. We're pushing now because we're more knowledgeable of what we're trying to do. We had a team in place from the onset, so we're able to do more units. And we're always looking for more certified contractors. The contractors that we have now, they are local, but we're looking outside of the area as well if anyone want to come in and help.
Why are we still in one?
Lead certified, you have to be lead certified, you have to be specific through Pennsylvania Labor and Industries. You have to be certified to do this work. So that's what's making the challenge of getting contractors to go through the certification process. But like I said, our local contractors are committed. They stepped up and did the certifications from the onset, and we're ready to go.
Do you want to talk about the risk assessor and what their job is?
Well, the risk assessor, once we've identified the child, if or not she had or he had high elevated blood levels, the risk assessor would then go out and test the entire home for lead, what's called a lead inspection risk assessment. Each substrate will be tested. Anything that comes up positive, the trigger level in homes for lead is 1 microdeciliter. So once we hit that trigger point, a lead action have to occur, meaning we have to do some remediation. She'll prepare that risk assessment. We would then prepare a specification for our contractors. They would submit a bid, and then we would commence with the work.
Thank you.
So
Okay.
this is only for children under 6? I mean, so if a family has older children, they don't need to have them tested, or?
No, you can be tested, but the emphasis for the program is on children under 6 because of the developmental sensitivity that they have to lead. Correct. So that's where if we can affect change during that age, that's where we can make a difference. I think as you become older, not only does lead not have the same developmental impact, but it's harder to address.
And how did you know or how did you guys figure out this is the first initiative of this kind?
Basically, like I mentioned in the onset, I attended a lead conference. All of the all the lead professionals across this country was there, and of course we have conversation. We have a coalition, a national coalition, National Safe and Housing Coalition. That's a national coalition, and we collect data. And the census from that conference that we just had is it was very difficult to get healthcare providers to help on the local level, as well as get administrations or the local leaders to participate in the program. And that's just because people, or we don't put enough emphasis on the ramifications of lead and how hideous it could be.
So it's both the on-the-spot results and the on-the-spot referral to city services, right?
Yes, definitely the on-the-spot results, because until we had the meeting with Ms. King and Ms. Peterson, I didn't know that a test exists. So once we discovered that a test was out there, we acted immediately, because this will give us instant results.
And no other municipality has that partnership that's currently involved in the program.
Not at this time, not for this particular grant. It was 14 other grantees that was awarded there in 2015. No one is doing this at this time.